in the small group and individual markets is also really, really important. You can look at rate review where you require insurers to submit any premium rate increases to the Department of Insurance, and the Department of Insurance is then required to really rigorously look at those rates and ask insurers to justify the rate increase or hold hearings even. And medical loss ratios are also popping up all over the country in proposals, and a lot of states have already enacted them. Essentially, a medical loss ratio, you say to insurers that for every dollar that you collect in premiums, you have to spend 85 cents on that dollar on actual medical services. So you can only retain 15 cents for profit, administration, and marketing. And what's nice about private market reform is you don't need a lot of new revenue, and I know that's sort of an issue in Colorado. So. Beyond those two really, really key steps, you can look at ways to help your high-risk population, reform your Cover Colorado high-risk pool by capping subsidies at a lower level and providing greater subsidies to low and moderate income people. You can look at a state-funded reinsurance pool. I know I'm going really fast, so any questions, come back to it, but that's another really important thing to look at. Subsidies for people who aren't qualified for your Medicaid or your CHIP programs. Some employer payer play or a connector. Now, some steps that states are looking at, we're a lot more cautious about. Individual mandates. You know, unless your state has really taken some important steps to make coverage affordable and available to everyone, you just can't go there. Even in Massachusetts, where they have a highly regulated market and they have a strong Medicaid and CHIP programs and they have subsidies on top of that, they're still going to end up exempting about 60,000 people this year from their individual mandate because coverage is still not affordable to them. You also really don't want to go the way of scaled back benefits plans or high deductible, high cost sharing plans. You don't want to make the trade-off of, well, it's not a good benefit package, but the premiums are low. It's got a high deductible, but the premiums are a little more affordable, because you don't want to ask people to enroll in a product that, where they're essentially paying to be uninsured, where they're never going to make their deductible. They're not provided with the benefits that they need. You're in no better position when you do that, and people don't really sign up for plans like that. So, on that cautionary note, I will turn it over.
Well, I want to thank the Progressive States Network for hosting this very valuable forum, and I want to thank all of you in Colorado for really moving this issue forward at the state level, because obviously that is where the action is, as Adam said. Just really quickly, I founded Small Business Majority after managing and running small businesses for about 15 years, because I really felt small businesses did not have an adequate political voice, and the voice that they did have was very ideological, sort of reflexively anti-government, and amazingly for small business people, not very pragmatic in its approach. And I particularly came to the realization that on the healthcare debate, the small business organizations were absolutely at the wrong side of the table. We're based in California, but we're nationally focused, and we do primarily research, all sorts of communication, and organization and mobilization of small business people. So what's the problem? The problem is that without small business support,